Okay, Dr. O, the skeletal system, osseous tissue, and the axial skeleton. Check this little image out here, really neato. All right, we've got all the different bones in a picture here, creating the picture. Totally awesome, definitely useful. I'd zoom in and check out the different names of the bones. Some basics of bone. Okay, bone is called osseous tissue. It's lined with cartilage on the outside, on the ends that are going to be coming together at joints. Like we've got the toe bone connected to the ankle bone, connected to the foot bone, connected to the shin bone, connected to the femur bone, right? All the bones that are connected, collectively we call them the skeletal system. The ends of the bone are lined with cartilage. That cartilage, as we'll discuss, is called hyaline cartilage. You look at it under a microscope, it's very clear and almost bluish, the way they stain it anyway. It's cushiony, it's lubricative, so that when the bones come together, it's not grinding like a mortar and a pestle. All right, it facilitates movement. Move your elbow right now, and you can see what I mean. All right, there's dense connective tissue in bone. All right, these collagen fibers that are laid down amid the salts that we're going to talk about, like calcium and phosphorus. There's an epithelium that lines the bone cavity here, and there's one also on the outside. Both on the inside and the outside, we've got these bone-making cells. Inside the bone, there's something called marrow. You've heard of this, no doubt. Marrow is red. Marrow can be yellow. All right. The yellow marrow is comprised of adipose or fatty tissue. That's why if you make a soup stock or something like that, you're boiling out, you're heating out all of the components of the organic components of a bone, all right, and cooking out all of that, leaving behind only the bones, only the concrete, essentially, all right, the calcium, phosphorus. So, and then if you make a soup and you leave it, or a stock, and you leave it in the refrigerator and you take it out, it looks like jelly. That's all of that collagen that comprise the bone. And we're going to talk about the importance of that collagen in a moment. There's nervous tissue that comprises bone. Here we're talking about a tissue, definition of a tissue being a bunch of cell types working together. And bone is an excellent example of that, because we've got all these components as part of our bony tissue. You take all the bones, you put them together, as previously, the little ditty I mentioned before. The foot bones connect to the ankle bones, connect to the knee bone, connect to the thigh bone, connected to the pelvis, connected to the low back, and da-da-da-da-da. All right? And all those anatomically correct terms we talked about. We got the femur here, we got the ilium, we've got the lumbar spine, we got the radius and the ulna, we've got the orbits, we've got the cranium, we've got the humerus, and on and on and on. All right? All those bones lashed together by ligaments and pulled upon by muscles with tendinous attachments. That's called the skeletal system. What are the functions of bone? Now, support is easy. We've got this dancer over here, able to stand up, does not have spaghetti bones, got strong bones that allow us to post on them and walk around, run, dance, whatever, what have you. Bones are rigid, all right, so that they allow us to get around. We call that locomotion. Then there's the protection of the skull, protecting the brain, and the rib cage protecting all of the viscera, and the pelvis, the pelvic basin, protecting the reproductive organs and the bladder and the intestines, right? So that's an important function as well. Movement, we've got bones that come together. They're called joints. And where those joints come together, those long bones in particular are lined with cartilage. We also have cartilage within the spinal bones in between, a special cartilage called fibrous cartilage, which is strong but also cushiony and flexible. Mineral homeostasis. So bones are storehouses of calcium and phosphorus. Pardon my horrible penmanship there. but it will fade. Storehouses of minerals within bones, calcium and phosphorus in particular, is really, really important because these minerals make bone strong, but they also allow bone to be reabsorbed into the bloodstream if need be, so that maybe we can carry out a complex chemical reaction like calcium for muscle contraction or any number of chemical reactions. Minerals are important. Blood cell production. So inside the long bones, you're going to find these hollow areas inside the bone called the medullary cavity or the marrow cavity. Inside there, that's where your blood cell production is a huge manufacturing plant. So red blood cells, white blood cells, platelets. Your immune system essentially comes from these marrow cavities. All right? All these little baby blood cells, they grow up and they serve many purposes. Maybe a red blood cell will circulate and it will deliver oxygen, pick up oxygen and deliver that to cells, or nutrients, or waste products, take out the trash, right? All that happens via the blood. All right? So really, really important to have proper blood flow and for the marrow to be actively making these blood products. Finally, there's triglyceride storage in the bones. Also, in the marrow cavity, you've got red marrow, which is the blood cell production. You got yellow marrow, which is fatty tissue, essentially. And that can be mobilized for energy, for making hormones, for any number of things. Here's the basic bone structure. So the shaft of the bone is called a diaphysis, and that's right here. And then the epiphyses. For a long bone, there's a proximal epiphysis and a distal epiphysis. All right, so your directional terms there. Then there's the metaphysis, which is this area. You see there's a little line there. The metaphysis is the area between the diaphysis and the epiphysis. That's right here. And this is where the growth plates live. Articular cartilage, I mentioned, this blue right here. That's down by the elbow. That's real cushiony, lubricated cartilage, hyaline cartilage. The periosteum is the skin of the bone. You can see it being reflected right here, peeled away. It's on there tight, but it's if you were to cut through it, you could peel it back in a fresh specimen. All right? And that is very rich with sensory nerve endings, free nerve endings. That'll allow us to feel pain. It's the only pain-sensitive aspect of a bone is the periosteum. The medullary cavity or the marrow is straight down the middle. And finally, the endosteum inside that marrow cavity, there's a line of epithelium, and these are cells, bone cells, that are differentiating and helping to grow and maintain bone. We're talking about the different types of cells that comprise bone. This is the important one right here. First of all, you got an osteogenic cell. That's like a blank slate. It's a stem cell for bones. Osteogenic cells say, all right, I'm going to create an osteocyte. And the osteocyte will just hang out in bone and listen to what's going on. All these little extensions here will be reached out to communicate with adjacent bone cells. And when it gets the word, hey, we got an active construction site, the osteoblasts will start laying down concrete, because osteoblasts build bone. And then the osteoclasts will come in and maybe they're, hey, we're going to take this wall down. We're going to do some excavation. They will break bone down. They'll bring their jackhammers and their picks and axes and all that crap, and they will, here's an osteoclast going to work taking this wall down. Then an osteoblast will come in and complete whatever construction project. So there's a constant communication and working together between the osteoblasts and the osteoclasts. Do we need to build bone? Do we need to break it down? Remodel bone? The whole idea is to make bone stronger, all right, and resilient and suit our needs. So the cell types I mentioned, this is the stem cell. Osteoblasts build. Osteocytes are dormant bone cells. They're just waiting on a job. All right, hey, the union calls up. We got a job over at down in Philly. Okay, I'll be there. Now you're no longer an osteocyte. You're going to be going on an active construction crew. You're going to be building bone, or you're going to be breaking bone down, working together. So now bone, we talked about the mineral aspect of bone. Everybody knows that calcium is good for bones. So calcium and phosphorus are very important. But if it was just calcium, just minerals in bone, then your bones would be like a stick of chalk, and they would just crumble with not a lot of pressure. So we need some stuff in and around those crystals, what are called hydroxyapatite crystals, or a combination of calcium and phosphorus. We're going to lay down some collagen fibers. All right. This is like the rebar inside concrete. And we'll put collagen fibers, calcium, phosphorus, so that it's a combination of these collagen fibers, which, think about collagen, what it does for your skin. It's really good for pliability and flexibility. So those collagen fibers are awesome to have in there. Then we've got the hydroxyapatite crystals in there. Here we see the blood supply coming in to deliver all this stuff. And the end result is we've got a strong but flexible bone. This is compact bone. This is the hardest kind of bone. So you'll find this around it's like the shell of a bone. So if you were to pick up, like, let's say a deer's thigh bone or femur, and you could strike something with it, you could wield it like a weapon, because it's got that outer shell, which is basically this thickness here. It looks like a bunch of little onions next to one another. And inside these little onions, we've got all these little osteocytes that live, and they reach out to one another. Hey, what are you doing over there? Hey, you got any work to do? Yeah, we got work. They all lay down concrete to make this area really, really strong. And then you can see that there's that blue thing here. That is called the periosteum. This is an osteocyte, just one of these little specks inside what's called a haversian system, which has got a central canal called a haversian canal. All these little osteocytes live around it, and they live in what's called a lacunae, which is like a little cave carved out in the bone, and they've got these little hallways that they will communicate down. Hey, what's going on down there? You really need any help over there? What's going on? What are you guys, down at the Comcast Center? Okay, all right, I got it. Lay down, guys, pull those trucks around. Lay down calcium, lay down phosphorus. Get some collagen over here. And they'll lay down some really strong bone like that. And the inside of the bone, okay, in the marrow cavity, in and around that area, there's what's called spongy bone. It's got these little spicules in there. Those little areas like that are evacuated, little holes in there. Kind of looks like a sea sponge. Right? And what this is about is this is strong, but it's also light. It's not as strong as compact bone. It's not as dense. But it's got these little air spaces in there, and that makes it light. So it's a good framework to have on the inside of a bone so that we can have bone strong yet light. So here's a good look at it in action. This is the femur. And here's the epiphysis of the femur. And here's the metaphysis, and this is the diaphysis. We can see that this white structure here that's even labeled for us, that's the compact bone, and then this is the spongy bone, all inside there. And if you zoom in on that image, you'll see that there are patterns to the spongy bone. We call that trabeculae, trabecular patterns. People think of bones as inanimate, like they're just rocks that allow us to, they're strong, they're protective, all that, but bones are actually very metabolic, so they've got a lot of activity in them. They get that because they've got a lot of vasculature nourishing them. so that the bones can constantly remodel and make sure that they're strong and flexible and serve all their many purposes. There's a lot going on in bones, not only to make them strong, but also blood products being made in here, right? Called hemopoiesis. So we have to constantly monitor what's going on and make sure that there are raw materials on hand so that bone can maintain itself. Here you see this little flap here. That's the periosteum. And all these different blood supply, there's an artery and a vein going in there, right? So it's got oxygen, nutrients going in. It's got waste products in the veins, deoxygenated blood, all that going out. So there's constant coming and going of nutrients and waste products in the bone as well. All anatomy is like this. All right. Need blood supply. Here's what's called ossification. Ossification is bone building. So now we've got a skull of a fetus here. These plates here are actively growing bone. There's a little jawbone being grown. And the process of bone building is called ossification, and there are two types we're going to talk about. So first there's intramembranous ossification. So if you look at all the little flecks, all the little purple spots in this temporal bone here of this fetus, those are the hydroxyapatite crystals being laid down in a cartilage framework. All right? So that's what bone essentially is. Let's say we got a piece of cartilage, like a piece of paper. And we're going to lay down all these calcium and phosphorus crystals in there, hydroxyapatite, and we're going to put collagen, and then you got bone. All right? So intramembranous ossification is where we take a membrane like this and we start to deposit hydroxyapatite. Then the second form is called enchondral. So we've got this cartilage model of a long bone. You see there's a little bit of a hint of what's called a primary ossification center in the middle. It gets bigger, and a blood vessel grows in, it gets bigger, and it gets bigger. And that cartilage model starts to have deposits of hydroxyapatite in there. And as it gets bigger, there's secondary ossifications that form, but they form at the metaphyses of the bone, so proximal and distal. And that's how bones grow in length. So two types of ossification, intramembranous and enchondral. Just know that all bone is produced in a cartilage framework. And when we talk about the metaphyseal, or the growth plates that are in the vicinity of the metaphyses, this is what they look like on an X-ray. That little growth plate. You might have heard about somebody having a growth plate injury. That's never good, because then the bone, if it means the person is developing and the bones are growing in length. So if there's an injury there, then that could cause a real problem, right? If we zoom in, we see that there's something happening here. There's a process by which bones are growing. There's the four zones of ossification at these epiphyseal or growth plates. First is the zone of resting cartilage, just bone tissue, cartilage tissue hanging out. Then the cartilage starts to grow in number. Cells grow in number. Cells grow in size. They get bigger. There's more of them. Then finally they calcify. The crystals are laid down. All right? And so you can see how that would allow a bone to grow in length. Right? It's a constant process. Here's another look at that. You can see the different layers. So here we've got the resting cells, and then we've got the cells growing in number, cells growing in size, calcification. Bone grows longer. Bones grow also in diameter by a process called appositional growth. Inside the endosteum, or the inside of the marrow cavity, there are cells that will develop there, and they will simultaneously lay down some cells, and resorbs themselves. As a result, bone will grow in thickness. Now the medullary cavity is wider, and the compact bone is thicker. Kind of looks like a stalk of bamboo. So extrapolate all this bone growth and development to when we break a bone. A callus forms, and the callus, you guessed it, is going to be cartilage initially. So cartilage is laid down, stuck in all these little cracks, the injured area. The blood supply is going to come by with the calcium and phosphorus and collagen and lay all that down. And we've got a big mess in here but it's organized, of the callus, the fracture site, and then it gets remodeled so that the bone is strong, perhaps even stronger than initially in that area. And the net result is the osteoblasts come in, they will lay bone down, the osteoclasts will break it down, do some excavation, and that 1-2 crew goes to work in there, osteoblast, osteoclast, rebuilding bone. How do osteoclasts resorb bone? We talked about, I believe, that ruffled border, which is like this little scrapers under here. They come around and they're going to release these enzymes. Enzymes are going to help to degrade the collagen in between the hydroxyapatite salts. So therefore, if the collagen goes away, then the salts can start to head back into the blood supply. They're available for us to travel in the circulation to, let's say, we need to go facilitate muscle contraction. Calcium does that. So we're going to resorb some of the calcium from that bone because it's a mineral storehouse, and the salts start to circulate in the blood. We're good. For bone growth and maintenance, we need a variety of vitamins and minerals, okay? Also hormones to help regulate everything. That's what I expect you to know. A big one is vitamin D, all right, which is particularly right now with the coronavirus, right? They're saying vitamin D is even more important for your skin, hair, and nails. It's important for your immune system function, and vitamin D is a precursor for intestinal absorption of calcium. So if you have adequate vitamin D, you'll be able to absorb calcium from your intestines. Sex hormones and their role on bone homeostasis, okay? As we age, and stereotypically women, but everybody, men and women, you can see that as the sex hormones start to fade a little bit, estrogen, progesterone, testosterone, the impact on bone is significant. So it looks like there's all these little holes been punched in the bone. And that's called osteoporosis, these little pores that are punched in the bone. Right? So the bone is no longer as strong, and that's where fractures can occur. Have you ever seen somebody walking in the mall, a little old lady with a forward head carriage and a big hump on their back, and they look like they're really old? This process has been advanced, and their vertebrae are starting to buckle under the pressure of gravity and lack of resilience of their skeletal system. Fractures, different fracture types. A fracture technically is a break in a bone. There are closed fractures, which you broke a bone but it didn't pop through the skin. A compound fracture, everybody knows that you see a piece of the bone coming out of the skin. That's ugly. A comminuted fracture means a shatter. A green stick fracture is something that happens in somebody who's younger, okay, where the bone kind of bends, doesn't break. An impacted fracture is, let's say, somebody, that little old lady walking in the mall. This is their vertebrae. There's pressure downward, just gravity. Maybe they fall or something like that. This can actually pancake down like that. So that would be an impacted fracture. A stress fracture Could be from running, could be from walking, could be from overuse of a particular body part. And there's no break like this. It's not a macroscopic break, but it's like a little crack that is formed inside the bone. And there can be swelling and pain and eventually a major fracture if we don't change our activity. And then there are fractures that are named by the individuals who identified them first. So a Colles fracture, for instance, this is of the distal radius. So that's your thumb side long bone of your wrist. So kind of looks a little bit like this. All right. So this would be the hand. If you look at your thumb and you follow the long bone proximally, you'll know what I'm talking about, and I'll show you some images of this. A Potts fracture and a Colles fractures. Fracture repair, here we've got the cartilaginous callus there, we've got the blood supply delivering all the raw materials, we've got remodeling with osteoblasts and clasts, bone and calcium homeostasis, talked about the role of hormones and about the constant reabsorption, bones as storehouses of minerals. We can use those minerals not just for bone strength and maintenance, but we need them for many biochemical processes. So we got to keep that in mind. I mentioned calcium, phosphorus, really important for chemical reactions in the body. All right? So we're constantly building bone and breaking it down to serve both our purposes of the bone, the support function of bone, bone strength, and also to draw from these bones for all the other biochemical processes that occur. There's some hormones that help regulate bones. Parathyroid hormone is a big one. All right, so this causes bone to break down. So we want to absorb. We'll get some osteoclasts in that area, and we're going to leach some of the bone, the calcium out of the bone, so we can use it for biochemical processes. Calcitonin puts it in the bone, man. Calcitonin in the bone, man. So that's going to deposit calcium and phosphorus in the bone. And then vitamin D, we talked about intestinal absorption. We get vitamin D from the sun. We get it from green leafy vegetables and dairy sources. Here's that elderly person. We know that as the A&P ages, we have a finite lifespan, and homeostasis will start to falter. That constant fluctuating internal balance will fluctuate or will decline as we get older. So we've got lean mass that is being replaced by adipose tissue. We've got osteoporosis occurring, and maybe some compression fractures of the thoracic vertebra. That causes the dowager's hump and the forward head carriage. All right, and all the structure and function that I mentioned heretofore starts to suffer. Hormones aren't good enough. Lean mass is not muscle mass. It declines. Adipose tissue, get a big fat belly, got a forward head carriage, got a dowager's hump. You're moving slow. You're sitting around. You're in pain. All of that natural consequences of aging. And you add into some rough living and maybe not an ideal diet, some extra weight, some arthritic change, some other chronic diseases, and aging can happen rapidly and it can impact the skeletal system significantly. As a result, the organic, collagen, etc., the blood supply declines, the calcium phosphorus hydroxyapatite crystals aren't as readily deposited, and you lose more bone than you gain. So what happens with exercise? They say the way to maintain a healthy skeleton is to weight-bearing exercise. So we look at astronauts, you take them up in less than gravity, Earth's gravitational forces. That actually serves a role to help us keep our muscles strong because we're working up against gravity, right? So you go into space and there's no resistance, And so things start to fall apart a little bit. Yeah, it's cool to fly upside down and do all that shit, but the muscles waste, the bone density can decrease, and so there's all kinds of different strategies that they have up there, tethering themselves to treadmills and exercising as much as possible, so that when they return to Earth, they can actually rehabilitate more quickly. Have you ever seen the impact that going into space has on the human body? It's pretty, you'll see all those astronauts that are going out for months or however long, and they come back, they're not walking on 2 feet immediately, even with the rehab techniques that they do in space. So the question is, if this is the impact that being an astronaut has on bone, well, what about leading a sedentary lifestyle? The axial skeleton is everything you see in blue here. We've got the skull and the facial bones and the jaw, the mandible, the ribs and the spine, cervical, thoracic, lumbar. These are the axial skeleton bones. Everything else is the appendicular skeleton, the appendix, like it's extra. Our extremities, upper and lower, are the appendicular skeleton. So this is cool, a really good visual here. Axial skeleton on the left, appendicular skeleton on the right. Different types of bone. We've got long bones here, like our humerus. You've got sesamoid bones that actually grow up inside of a tendon, like your kneecap, your patella. We've got irregular bones, which the vertebrae are. Flat bones, like the bones of the skull and the sternum. Sutural bones are going to be, sometimes you'll find them in the skull. There are numerous surface markings of bones, okay? Your eye sockets are orbits. Your nasal cavity is the choanae. Your teeth sockets are alveolar processes. All right. Bunch of different bones comprising the skull. For instance, this is the frontal bone, this is the maxilla, the zygomatic bones, this is the sphenoidal bone, temporal bones. All the cranial bones come together, and again, imagine that intramembranous ossification occurring. The net result of that, when the bones fuse together, they do so, they zip up with these sutures, and everything comes together. Here's your ear hole, or your external auditory canal. Some facial bones here. We've got the nasal bones, zygomatic, maxilla. This is your perpendicular plate of the ethmoid, sphenoid, mandible, temporal. Here's the nasal septum here. You see these little spots up here and right here. These are called sinuses. These are actually evacuated little air spaces within the skull and face that are like little crumple zones for trauma. They also make the skull light. People can get inflamed sinuses, of course. Look at all the bones that comprise the eye socket. All these bones that fuse over time and create this basin where our called the orbit, where our eyeballs live. And here's cut off the horizontal section of the skull. We look down, the brain, this would be the frontal bone here. Sphenoidal bone, this is where your pituitary gland lives. This is where your brain stem goes through, called the foramen magnum. This is where your occipital lobe lives, your temporal lobe. Your brain sets right in there. And the sutures, this is a sutural bone that we mentioned earlier. It's like a little area, like a little island. And these are all the sutures that connect the bones. Different look at it. Look from inferior. Here's the foramen magnum. Brain stem would come down here. Spinal cord. Occipital bone lives back there. These are the sharp, pointy bones posterior to your ear. It's called the mastoid process. A lot of bones, a lot of nomenclature, okay? In other words, different names, different functions, structure and function of the bone. 206 bones. There's the frontal sinus and the maxillary sinus and the ethmoid sinus. So if somebody says different people will feel the effects of allergies this time of year in these areas, right? Somebody has a headache, it's a sinus headache, right by their frontal region there. And then right between the eyes, the ethmoid air cells. A fontanelle is that soft spot in between the bones of the head, cranium. So this is the anterior fontanelle, soft spot in the baby's head, where the bones have not fully fused yet. You can see the cartilage in there, where they're starting to fuse, or as I say, zip up. And these sutures are strong. All right, they're not going anywhere. Once they fuse, it's like the clasping of your hands. It's very, very strong fusion. And then there's even more development. But the whole idea of the fontanelles is so that the brain can grow in size and that the skull bones can accommodate that. Otherwise, it would keep the brain like a friggin' pea. So if you want big brains, you need sutures to permit development. Here's the hyoid bone is one of the axial skeleton components. It's the cool factoid. It's one of the only bones that's not connected to any other bone by another bone. It is connected to other bones by ligaments and tendons, and muscles will pull on the hyoid. All your tongue muscles will attach to that. All the muscles for speech will attach to the hyoid, and they have names accordingly, like the mylohyoid, the sternohyoid. All the muscles in that area will attach to this area for speech, for mechanical mastication, muscles of mastication, help us chew. The vertebral column, okay, we've got 26 bones. Our neck, our cervical spine, we've got 7 vertebrae. Our mid-back, our thoracic spine, we've got 12. Our lumbar, we've got 5. Our sacrum is actually 5 fused bones. And our coccyx, it looks like a little rattlesnake tail, that is got 4 fused segments, right? In between all of these vertebrae, we got discs and nerves come out every which way. And all those nerves are going to go and plug into the arms and the chest and the abdomen and the legs. Control so many things. The spine has some curves. This curvature in the cervical spine is called the cervical lordosis. Lumbar has lordosis as well. These are reverse curves. And then in between the shoulders, we got the thoracic curve, and that's the kyphosis. So cervical lordosis, lumbar lordosis, thoracic kyphosis. So a hyperkyphosis is where somebody's got like a hunchback. The vertebra, they've got a vertebral body, they've got a spinous process, which is what you can feel if you run your fingers down your back. And then out laterally, they got these things called transverse processes. And then, so 1 spinous process and 2 transverse processes that come out, and they allow for muscular attachments and essentially movement. If you can twist and turn and side bend and all that, you got muscles attaching every which way to these transverse processes. You have an intervertebral disc between the vertebrae. The thorax is part of the axial skeleton. We've got ribs, 12 ribs, 1 for each thoracic vertebrae. And then this brown structure in the front, that's all cartilage, so that's not bone. So the ribs come from the mid-back posteriorly, then they move around to the anterior, and then they plug in with a little piece of cartilage and attach to the sternum. That allows the rib cage to expand and have some flexibility, but also still be strong. That is the axial skeleton, my friends. If you have any questions, please reach out.